Hi, everyone. Thank you for joining me today. Oh, hold it. Now it's recording. Hi, everyone. Thank you for joining me again today. Today, I am joined by Cheryl Tyler. Her uncle, Ervin Fox, was a resident at the Grand Rehabilitation and Nursing in Chittenango from January 2019 until May 2019. And she wanted to join me to tell her story, or rather her uncle's story, and her experiences and what she witnessed while he was a resident there. Hi, Cheryl. Thank you for joining me today.
Hi.
So why don't you give us a little background here? Your uncle Ervin, how old was he when he entered the nursing home?
93.
93. And what was his condition when he entered?
He had times when he was real alert. He suffered from Parkinson's, and he had other times where he was totally incoherent, totally out of it. But he had times when he was really alert.
And when he was younger, he was quite the professional man.
Yeah, he was engineer at Kodak in Rochester. He retired from there.
Okay, so he was an accomplished, educated individual.
Yeah, well-traveled. Yeah.
And you said he was very, neat and orderly.
Oh, yeah.
And that he also followed doctor's directions, unlike some patients who can be non-compliant, that if a doctor gave Ervin, therapy to do, that he was pretty responsible.
He was, yeah, very responsible.
Okay, so that's interesting to know. Was he on Medicaid when he was a resident there, or
no?
No,
he was private pay.
So he paid out of his own pocket for his time at the Grand. And If you don't mind me asking, how much was he paying per month?
Over $14,000.
Okay, so it was not inexpensive for him to be there.
No.
Okay. And during that time when he was there, can you give us some idea of your experiences? And you chose the Grand in Chittenango because of its location. Is that right?
Yeah, I read a lot of terrible reviews, but my sisters both live in Chittenango and I live 7 miles away. So we thought between the three of us, my cousins and my parents, all of us very involved, that we could keep him safe because we were so close by. But we were really mistaken.
Was that how it happened while he was there?
Yeah, he was in the hospital. He went in the hospital from Brookdale and Manlius assisted living, but they couldn't give him the care. He needed more care. So we got him in the Grand in Chittenango so he'd be close by.
Right, and while he was better care. Okay, and while he was there, do you feel like the fact that you were also involved in close by, is that did that make a difference in the care he received?
Or it didn't make a bit of difference. It didn't make any difference.
So why don't you tell us what your experience was?
Well, he was very fearful. He wouldn't let us complain if he had a problem because he was so afraid of repercussions when we weren't there, because we couldn't be there 24 hours a day. But we witnessed nurses yelling at other residents. He was right by the nurses station, so we heard a lot of interaction between other residents and nurses and aides. But he'd push a call bell because he needed to use the bathroom, because he did wear depends because for urination. But he was able to do the other things in the bathroom, but he could never get anybody to take him in the bathroom. And if he got lucky enough to, he would get left in there for an hour or two. And then he was completely immobile. He couldn't use his legs because they were numb. And I don't know. We witnessed medications the nurses said they gave him. They signed that they gave him, and I was there. I know they didn't give them to him. And when you're on Parkinson's meds, you have to be given those meds at specific times every day. And I would notice that his hands were shaking more than usual sometimes. And that was always a good indicator that he hadn't got his meds. He never, I'd go at all times of the day, from anywhere from 5 o'clock in the morning till midnight. He never got oral care ever, unless I put him in the bathroom and helped him with brushing his teeth. He always slept with his partial in, which he had never done, but nobody would help him at night. They just kind of throw him in bed, and they wouldn't put the fleece foot things on his feet to keep his feet from heels from getting sore. Just, basic care that he needed. So
Now, you took pictures of some of this stuff when you found your uncle in certain conditions, and I want to show these photos so that we can discuss them, because it's really heartbreaking. So let me just. So we see here.
That was at 5:30 in the morning.
That was how 5:30. Okay.
He was one of the things where he was totally out of it. And I had to stand next to him by his legs. I pushed his call button. I walked down the hall to get there in the morning, other than the woman that let me in. And I think she was like a maintenance person. There was not a single soul anywhere. I pushed his call bell and waited and waited. I started crying because I didn't dare leave him, because I was afraid he would fall out of the bed, because his legs are where, in that picture, where I kind of picked him up and put him on the bed. They were literally hanging off the bed. And I did run out to the hall and took a quick look, and there was not a soul anywhere. His call bell light was flashing, but there wasn't a person anywhere. So I called my cousin who lives in Syracuse and had her call the Grand and tell them I needed somebody in his room immediately. And it was probably 20 minutes, half an hour before anybody came. And nobody ever took responsibility for leaving him that way, because I wanted to know who the aide was, and they would never tell me. So I don't know who did that to him.
And it does not look like he's wearing pajamas. It looks like he's just
they were getting him dressed. That's how they left him. Somebody had come in and dressed him that far and just left him laying there like that.
At 5 o'clock in the morning?
Yeah, it was 5:30, I think.
5:30? Okay. Was he an early riser?
They used to drag him out of bed every morning at 5, whether he wanted to get up or not.
Okay. The next photo we have here, he's sitting in a chair, and there's a white substance on his mouth.
There's also a pill. If you zoom in on the picture on his shirt, you can see a pill laying there. And that horrible, green shirt that they put on him that was 2 sizes too small, and they used to leave him in that. Yeah, he has dried pills all over his lips. He was totally, you can tell he was totally out of it. He couldn't answer you. Non-responsive. And the nurse had come in and just put the pills in his mouth, and he drooled, and they were dried on his lips.
Okay, I just zoomed in a little bit there. And it does not look like he's in
he's a mess. He's a mess.
Yeah, it must have been very upsetting for you to come in and find your uncle this way.
When I first went in the room, I thought he had vomited, and I ran out to the desk and I told the nurse there that I think Ervin had vomited, and she came in, but she didn't admit to putting the pills in it. Nobody ever admitted to doing anything. And because then I realized there's a pill on his shirt, and I realized it was dried pills on his lips. And they had told me many times when he was like this that they couldn't put pills in his mouth if he was unable to swallow. And he was very unable to swallow.
Okay, so they were supposed to give him the medication and watch him swallow the pills because of his Parkinson's. He was a choking risk.
Give him a sip of water or whatever.
Okay, so clearly that didn't happen here. And the next photo, we see that he has a head wound.
Yeah, some of that, he had Merkel cancer removed from top of his head, and he had a lot of like fungus growth types things.
Okay, so
But
that's
the red area, he fell out of bed. And I think he hit his head on the nightstand, which was right by his bed.
Oh, Lord. And here's a picture of his feet. What are we seeing here?
Yeah, that was from the fall too, another injury.
And here, is that from the same fall?
Yeah.
Okay. So these are disturbing images. And the fall out of the bed, I mean, we see him here where he's practically falling out of bed.
And see, there's no pad on the floor. This was before they they were putting a pad on the floor, but they had told me early on when he first moved in there, because Ervin always slept with a bed rail, always. They said it was a restraint and they couldn't use them. Now, and then towards the end of his life, they said, "Oh, we have a bed rail we could put on his bed," but they had put pads on the floor.
You had requested a bed rail because Ervin was having a problem staying in bed. He was frequently rolling out of bed.
He did that all of his life. He always had a bed rail. He'd come to visit my parents. He always brought one of those portable bed rails to put on the bed. He always slept with a bed rail.
But they would not allow. But they would not allow you to put in a bed rail when he was there because they said it
was a restraint, and they weren't allowed by law.
But then at a certain point, they changed their mind, or the policy changed?
Were like, I said something. This, I think, was towards the end of his stay there. And the nurse was like, "Oh, we have bed rails. We could put a bed rail on his bed." But they never did it. They did bring foam wedges and stuff. They'd wedge him, put under him.
Okay. Did that help? Did the foam wedges help keep him in bed?
Yeah, they helped a little. It was a lot to help with a bed sore.
Oh, he had bed sores.
Oh yeah, he had a really bad one.
Did he have bed sores prior to his enrollment? No. Okay, so the bed sore was something that developed while he was under the care of the Grand.
Oh yeah.
And you said it was bad bed sore.
Yeah, the one on his tailbone was a big open hole. And I would complain and ask the nurses, did you change it, or ask the aides if they'd looked at it? And all I ever got was, "Oh, I don't know." And we'd tell them, "Well, we want him rolled over. We want to see it." And it was horrifying because, it was a big open hole. So then the nurse would come in. They have to get a doctor's order, so it was all delayed. But they would pack it with something and put a padding on it. And as long as we kept right after them, they would do it. But the minute it started healing, they'd stop doing it and it would open right back up again.
You also told me yesterday that he had a lump by his ear that you complained about.
Yeah, in front of his ear, it was causing him pain. Yeah, it was like here.
And you told them that he had a history of cancer.
Yeah, Merkel.
Okay.
The doctor said it was a hematoma, treat it with ice pack or heat packs, which they do it once in a while. They might do it if we said something, but it was something that was supposed to be done regularly, and they never did it. It didn't help him anyway. And that went on for quite a while, and it kept getting bigger and bigger and bigger. And finally, they got an appointment with the guy that had done the surgery on top of his head, and it was I think it was Merkel again.
So it was cancer. It wasn't a hematoma, it was cancer.
Yeah.
And they delayed following up with an oncologist
Mhm.
by treating it as if it was just,
A hematoma. That's what they kept saying. It's a hematoma.
okay. That's really upsetting to hear. I mean, this must have been so frustrating for you.
It was horrible. But I mean, they wouldn't listen. They didn't listen to anything. But, it kind of goes with what the doctor said. One night, Ervin was really out of it. He'd had a fever, and we thought he might have pneumonia. And the doctor came in and told me and my sister that, well, they don't treat infections because these people come here to die. They come here for one reason. And he said, so we don't treat the infections. We just let them go because that's what they always die of.
Wait, I'm sorry. So the doctor, was this like the medical director of the facility?
Their only doctor.
The
Yeah.
doctor said to you that that people go there to die so they don't treat them
Yeah.
for certain things?
They don't treat them for any infections, he said. They go there for one thing, he said.
What was Irving's wish? Now I'm my mother's healthcare proxy. She and I had many conversations about what her wishes were. What was his wish? Was his wish to not be treated, to just die? Or
No, Ervin never wanted to be put on life support or
okay.
anything like that. But obviously, he wanted to live because when he had that lump, he wanted to go to the dermatologist that had, done the surgery for the Merkel. He wanted to go. So he obviously wanted to live. I mean, he was 93, he was sick, and he was at the point where there's no point in this anymore, but he never said he didn't want like Merkel treated cancer. He wanted the treatment. So,
Tell us about some of the other experiences Irving had. Yesterday, you and I spoke because you said people have asked you, why didn't you move him? And they did move him at one point. And
yeah.
right, when you just tell us, when you signed him in, there was this agreement that he would stay in his room.
Yeah, he had a private room. It was on the rehab side, but it was their only private room. But because he was diagnosed with MRSA and Kraus in the hospital, and they used all those, we had to wear gowns and gloves and masks and all that. So they said he needed a private room anyway. But when they heard he was private paid, they are going to make room. So they had a room on the rehab unit. And they said the agreement was he could stay there for the entire time he was there. So about, I'd say maybe 2 months after he was there, I got a phone call one night from the social worker. Ervin's healthcare proxy, my cousin, was away. He was in Bermuda, or he was gone. And he told me that they were moving Ervin over to the other wing, the long-term care wing. And I said, no, I said, you can't move him. He gets so disoriented. A 93-year-old person, you can't just move them, even in the same facility, because he gets so confused and he doesn't know where he is. And I argued and argued and argued with this man, and my husband heard the whole conversation. He was sitting right here, and he was just like, well, we're moving him. So they moved him. We weren't even there. They just picked up his stuff and shoved him in a room on the other side. And he was so confused. He didn't know where he was. It was horrible. So my cousin came back from wherever he was, and he argued with the director, and he told him that was not the agreement. And the room had sat there empty for a week. They hadn't even moved anybody else in there. So finally they agreed they were going to move him back. And it was like a downhill slope for Ervin after that. I don't think he ever really recovered from all of that. He never knew where he was anymore.
So you saw a real decline in him after.
Oh yeah. Yeah, it was really, really hard. People don't understand, I guess, unless you see it. I never would have understood it, but I lived it with Ervin. But it's like, people said, well, why didn't you move him to a different facility? He didn't want to move again. He was scared of moving. He just had kind of given up and was gonna sit there until he passed away, which is what happened. But it just took him so long to orient himself to his surroundings, and because Irvin was a meticulous man all of his life. I mean, organized. That man was so organized. He knew where everything was. He like drove me crazy sometimes. But and when you move them and everything's here and there, and he couldn't recover from that.
So you saw a real decline in Irving, and to be clear, so people remember this, he was only there from January 2019 to May 2019.
Yeah, May 21st he passed away.
And what other experiences did you have there? You were saying that you were having problem with his clothing and belongings?
Yeah, his clothing would disappear. Things came up missing all the time.
You also told me that they wouldn't let you bring in food from the outside?
No, because Irvin had Parkinson's, so they said he was a choking risk. He had a speech therapist that helped him. He knew the system. He had to clear his throat really hard twice, take a swallow of water, clear his throat really hard again. I mean, Irvin knew what to do, and we knew what to do, but they said we weren't trained, so we couldn't feed him.
You couldn't
He
feed
couldn't.
him. You couldn't
No.
feed him. If he needed assistance, you couldn't assist him.
Oh, I did, but they'd get really mad about it.
Was there
So
somebody there from the staff to assist him?
no, they were always too busy. Even when he sat in the dining room, I'd try to get there for meals, because he'd just sit there. He'd have his spoon trying to get something to his mouth, and it would just drop. And he, once in a while he did get assistance, but one morning the nurse or the aide was just shoveling food in his mouth, and he couldn't eat like that.
Again, because he had Parkinson's, so there were certain ways that he had to eat.
Yeah, and I'd sit at the table there was a blind man that sat with him, and then sometimes someone else, but they would bring this poor blind man his meal. They'd plop it in front of him and go, okay, this is at noon, this is at 3. And from my experience in nursing, I know that's how you teach somebody that's blind where the food on their plate is. But you're not talking about just somebody that's blind. You're talking about somebody that doesn't even know where he is, or he can't retain that information. He couldn't remember. So I would guide his hand. I would guide his hand with a spoon or the fork to his food and get a little on his food, and then he would put it in his mouth. And they didn't want me helping him either. And I wasn't actually feeding him. I was just guiding his hand to find his food.
What was your experience or your observation in this 4-month period on staffing? Did they seem to have adequate staffing?
No. A lot of times they'd have one aide for the entire wing.
Do you know about how many residents they would have in that wing?
There must be 30, 40 in the wing. It was a rehab wing. So a lot of the people in there didn't need as much assistance. When he was on the long-term care wing, that was horrible. People lined up in the hall crying for help, residents, wandering around. It was awful. But there were more staff over there. That's why I tried, when they moved him over there, to think, well, maybe he'll be better off, because there does seem to be more staff. But the residents over there also needed a lot more care. So Irvin wasn't better off. It was worse.
And interestingly, you had said your experience in nursing. Let's tell folks about your experience in nursing, and then what you went on to do when you were working.
Mhm. I graduated, I went to LPN training when I was in high school at BOCES, and I graduated and I got a job in a nursing home, and everything I'd been taught, it it like went out the window. Sterile technique, all of that. And I ended up leaving nursing. I never took my state boards, and it was because of not this nursing home, a different one, but because I couldn't, I wanted to be able to sit down with the person I was taking care of and hold their hand if they needed it, or just be kind. And there just wasn't enough. You couldn't. There weren't enough people to take care of everybody. And you'd get so many residents and you'd have to give so many baths, get everybody fed, and you were just on a dead run and you never had time to really be a human being. And they need that more than they need anything.
Right. But you did go on to work in a a portion of human services in the care industry, though, right?
Yeah, I went to work in residential group homes for the developmentally challenged.
So you understand what it's like to have to care for a resident who has special needs
Yeah,
and the kind of care human beings should receive. So when people at
yeah,
home are listening to this, it wasn't like you worked in the banking world. You worked
no.
in human services.
And I worked in some really good group homes, and those, even I worked with nonverbal, non-responsive residents, but it was like a family. Everybody, they cared about them. They cared about their well-being. If they were crying, they cared. If they were, we had a resident beating his head on a wall, and I figured out it's because he had a headache and he couldn't tell anybody. But in a nursing home, it's kind of the same thing. They can't always tell you what they need. It's up to the aide or the nurse to have some kind of insight, if you're working with that population.
Right. So I just want people to understand that you're not being hypercritical as somebody who doesn't have experience or skills in this um in this type of situation. You've done the work
Yeah.
and you have something to compare it to. So when you were caring for Irving for that period of time from January 2019 to May 2019, it really affected you.
Yeah. Oh, it's almost like PTSD. I drive by that nursing home and the memories of what he went through in that place. And I think about the residents that are there now with COVID. I can't even imagine how horrible it is in there. I mean, I can't imagine. Irvin could sit in his room all day and nobody would check on him. Nobody, even if his call light was flashing. It just,
So
I
Cheryl, let
don't,
me ask you. So this happened, you had this experience 2 years ago, and you and I are talking about this today. What made you come forward to talk about your experiences now?
because I saw Regine Wallace's video, and and then I saw comments, that people, oh, she was being difficult or this, or trying to blame it on her. And it's like that in the Grand. And people don't get it. They don't understand. And I just wanted to, be a backup. Like, this does happen there. So, and your loved ones, you put them in there because I wanted peace of mind when I was home. I wanted to know that Irvin was being taken care of. And so many times he'd call me and he's like, I really need to use the bathroom and I can't get anybody to come. And we'd have to call the front desk and tell them that Irvin needed an aide, like now. He'd been waiting, and Irvin was not impatient. He would sit there and wait and wait. He hated calling for us to call to get help because he was afraid when the aide came, they'd be mean and rough. And they were.
So
Or
he
they,
experienced retaliatory action if he did try to reach out for help.
yeah, very much so. I called the ombudsman person for this county, and she said the Grand had so many complaints, so many. But even with her, at first I thought, oh God, now somebody's listening. Now something will happen. And she went to talk to Ervin. He happened to be having a good day, and he told her, "Oh, everything's fine." And I told him, "Why did you do that?" And he said, "Because he doesn't want to complain, because he said, you don't understand, when he's there alone, he's afraid. He's afraid of how he'll be treated." I mean, he was deathly afraid there. So he didn't dare speak out. He never spoke out.
And just so people understand this, you didn't have the resources to care for him in your home. And
No.
your sister, who was willing to at the time, her husband was sick and dying. So she
Yeah,
was
he
not
had
able to
brain
do it.
cancer. Yeah.
And so you guys, you did want him to receive good care, but I don't think people understand, it's in certain situations it's not so easy, because I considered bringing my mother home, instead of having her in a nursing home, but I couldn't care for her the same way she could be cared for in a facility, because I didn't have the resources, the equipment to care for her. So I
There's also an emotional component to it. It's, all the, like, I wasn't really comfortable doing my uncle's personal care. I mean, even with my nursing background, he was a man I looked up to all my life. And, it made me, I ended up doing it at the end. I had to, because nobody else would. Nobody ever, he got a bath once a week if he was lucky. And he hated that. He said it was brutal. He said they scrubbed him like, I mean, we used to laugh about it with him, because he said, "Boy, they scrub him." But they were pretty rough, and and the room was cold, and he hated it, but he had to have a bath once in a while. So,
what about any kind of activity? We you and I spoke about this yesterday, because I had questions, and I told you that the grant had given a presentation in front of our legislature. What about amenities? You were saying that there was a TV, but it wasn't very big. It was kind
yeah,
of in the
he
corner.
couldn't see it. It was up in the corner of the room, and he couldn't even see it.
And you wanted to buy him a bigger TV.
Yeah, we wanted to buy a bigger TV and have a mount put on that would swivel so he could see it when he was in his wheelchair. And they said, absolutely not. They wouldn't. They
Okay.
wouldn't allow
Um,
it.
they wouldn't allow it. What about, I mean, was there anything, I mean, because he was private paying a lot of money. You also said
Yeah.
that they just had like basic cable. They didn't offer a lot.
Yeah, just the basic. Because he really liked sports. And if he couldn't see it, at least he could hear it. But he couldn't get any of the channels that he was used to watching. And we said we'd pay for cable for him. And no, it was for the whole building. So they couldn't do that either.
So what did they offer him? Was he getting physical therapy?
He got some physical therapy. The physical therapist at that time was a young man. He would come get Ervin, push him to the physical therapy room, not even say, "Hi, Ervin, how are you this morning?" Nothing, total silence. And I saw him with many residents, and he never greeted anybody. He never even spoke. He never said hi to me. He just never spoke to anybody. And then they'd go down. Sometimes I went to his
Oh, hold on a second, Cheryl. We're a
physical
little frozen.
therapy with him, and it can.
We froze up for a second there. So let's
Yeah,
start over.
they would be in physical therapy in the room, all the residents sitting in a circle, half of them asleep. And they had a couple of physical therapy assistants that they were pretty good. But there was several people in the room, and they all needed hands-on help. So they weren't, I don't know. I was a home health aide, and I also worked with physical therapists and did physical therapy with people. And this to me wasn't physical therapy. When he went in there, he could walk with a walker. I would follow him with a wheelchair. And it wasn't long after he was there, he lost all ability to walk. all ability.
I
And
would
they
think,
didn't encourage him to walk or stand.
yeah, I would think for someone with Parkinson's, physical therapy would be
It was
important to
really
keep.
important. Yeah.
Yeah.
I brought like bands and stuff, and I'd sit in his room with him and have him, do what I could do in his room. But they wouldn't allow me to try and help him walk and follow him with the wheelchair. They didn't allow that.
Now, you did say to me that there were some good people there, that it's, we don't want anyone to think that it's just filled with um, people who shouldn't be working there, but there were some good people.
Yeah, there were. And I was full of praise. Any aide that came in there was one young aide, her name was Amber, and she made Ervin feel special when we were there. And we'd say, I'd leave and I'd tell her, I feel better. Like I can go home and breathe easy tonight because I know Amber's on the shift. But if Amber's the only aide there for all these people, she can't be there for Ervin like he needs. I mean, just to pop in, sit down for 5 minutes, or to
Yes.
do his PM care or whatever. The best they could do is get him in bed.
So even when there was somebody that you were happy was there caring for him, their workload made it such that they were not able to give Irving the care that he
Yeah.
deserved.
No, and it was that way back when I was 18 and I was started out working in a nursing home. They need more people. It would benefit the residents, it would benefit the aides. I mean, the aides would get bitter and be exhausted and they'd take it out on, and you're dealing with residents that Ervin at times could be combative. He was losing his mind. It wasn't Ervin. It was whatever was going on in his brain. And, you have to be calm and patient and go at their pace. And they can't. When there's only one aide and they have to get 30 people in bed, they don't have the time to stand there and reassure him that it's okay and go over where he is and what they're doing. They don't have time for that. They just scoop them up and throw them in bed and leave them there. So
That's
the
Cheryl, thank
patient,
you.
it's a patient to staff ratio that's way off. There's more people working in the kennel at the SPCA than there are working in these nursing homes taking care of our loved ones.
I think you bring up a very good point, which is that staffing equals care. People cannot, residents, elderly people, disabled people cannot receive care if there is not adequate staffing.
No, and it's a snowball effect because then they're exhausted and they're frustrated. And even the good ones, they don't stay. We saw that over and over at the Grand. We'd have a good aide, and then all of a sudden one day it's like, where is she? Oh, she quit. She couldn't take it anymore.
And just so people understand, again, your experience was over a 4-month period of time.
Yep.
So within a 4-month period of time, you saw people come and go often enough for you to understand that they had a staffing issue.
Oh, yeah. Big staffing issue. Really big one. But, the administrators, we never saw the administrators. They didn't come check on residents and ask how they were doing, if they had any complaints. And
Speaking
even
of,
the social worker.
did you make complaints Ervin was afraid of you complaining. So but did you try to talk to somebody like maybe the unit leader, nurse, or the director of nursing?
All the time. We were always, my whole family is my cousins, Phyllis and Fran, my parents, and both of my sisters. We were there all the time trying, and we got lied to over and over and over. It was ridiculous. My brother-in-law was there and heard nurses screaming at a resident because she wanted to drink, and while she's going to have to wait. And Ervin heard this. Ervin was in the room right next to the nurse's desk. So he heard the yelling and the screaming, at the residents. So he was really afraid. He didn't want to upset any of them. So, it was like a double-edged sword for Ervin. But, you should never have to be relieved that your loved one passed and it's over for them. And that's how we were the day Ervin, I was sitting right there holding his hand. I had my hand on his chest. I felt his heartbeat for the last time. And all of a sudden it was like relief because he's gone now and he doesn't have to suffer anymore. It was awful. Sorry.
No, it's okay. I'm sorry.
I mean, being there when they took him out, it was like he's finally released. His suffering is over. And nobody should have to ever feel that way. And there's so many residents there that have no family. I can't even imagine. I mean, I helped other crying residents that were sitting in the hall. One woman had a shirt on that was so tight, it was pushing her hernia in. And the nurse is standing right next to her, totally ignoring her. And I asked her, what is wrong, Dorothy? And she told me. I said, well, I took her in a room and I changed her shirt for her. And and then I get in trouble because I'm helping residents and they don't want you to do that either. But I can't walk past somebody that's in the hallway sobbing with a nurse standing right next to her, nobody to help her. And there's so many people that are there that have nobody. I'm telling you, anybody should go walk into that long-term care wing in that nursing home. Just walk in there and walk down the hall. And it's horrible. It's horror at its finest. So, and my grandmother was in Krause in Morrisville. And, my brother-in-law used to complain because, people in the hall. And I said, yeah, but like her, they'd put her in a recliner by the nurse's desk. She'd be laying there screaming for help, but the nurses would walk by her and go, it's okay, Martha, you're at Krause, we're right here, you're okay, it's okay, you're not alone. And I told my brother-in-law, yeah, it's horrible to see, but they're doing the best they can. And they do not do that at the Grand. They do not do. Anybody with their own eyes could walk through Krause and Morrisville. You're going to see a whole different thing than if you walk through that long-term care unit at the Grand. It's horrible. It's like a nightmare. People sitting in the hall like in all sorts of disarray, and
I can tell. I mean, it's 2 years later and you are still haunted.
Oh, it's in my brain. It's in my brain. It's like people have been thrown away. And it's not all the nurses and the aides' fault. There's too many people and not enough of them. So, it's a bad situation anyway. Our elderly population, it's a horrible situation, but these nurses and aides don't really stand a chance, especially in a place like the Grand. Now, it's depressing to go to Krause in Morrisville, and my husband's ex-wife is a nurse there, and my sister was in there for rehab, so I went there a lot. My grandmother was in there. She passed away there. But it's a whole different environment. It's still sad because you have people that are at the end of their life, and they are there for one thing. But does it have to be like torture and suffering and negligence? Because it's not like that at Krause and Morrisville. It's sad because, of what it is, but it's not. At the Grand, it's like a torture chamber is what it's like. Walking down the hall in that long-term unit. That's all you have to do is go down there, walk down through that, and come out and tell me how you feel after you see that. It's awful.
So when you saw Regine Wallace's video, you knew.
Yeah, I knew she was suffering. And thank God she had the mental aptitude and the ability to, tape it, record it. My uncle knew nothing about technology. He never could have done that. And he was too afraid to do that. That took a lot of courage for her. And I truly believe when they shipped her out to that nursing home hours away, that was retaliatory. I know it was with everything in me. I know it was. And that's what Ervin was afraid of. He was afraid they'd kick him out if he complained. So
Cheryl, thank you so much for telling your
blood
story.
pressure's up.
No, I think you did I thank you for telling your story. Is there anything else you would like to let people know about? The bottom line, what's your message to folks about the Grand?
Don't put your loved one in there, because you can't keep them safe. With all of us, there were 3, 4, 5, 6, 7 of us that were constantly on it, and we could not keep Ervin safe. So
Okay, thank you.
at Kraus, you'd have a heavy heart if you had to put a loved one in there, but they're going to be taken care of.
So you felt like with your grandmother when she was in Kraus, you did not have to watchdog her the same way you did.
No, they did the best they could do.
Okay.
It was a difficult situation. She was blind, she had dementia, but she was never just left in her room to rot. I mean, they could have easily just left her in her bed. That would have been easier for them, but they didn't. They'd get her up, they'd get her out by the nurse's station, have her comfortable in a recliner. They'd have pillows under her arms. And when she screamed and cried out, they would respond to her. They didn't just walk by her with a blank face. So, nursing home is hard. Working in a nursing home takes special people, but it can be done. It is done. There are a few good nursing homes. So,
Cheryl, thank you so much for
problems, but
thank you for agreeing to talk to me so that people can understand what you witnessed, what Ervin's experience was. And I think you've got a great voice for advocating for the elderly. And in my journey so far, I think that we need more advocacy for the elderly. I think we need to start changing some laws.
I think I just got worn down with Ervin because I complained so much. And when I got the ombudsman involved, I was hopeful. And then I lost hope. So I've been silent until I saw Regine's video. That got me fired up.
Well, I'm glad that it got you fired up because we need more people like you who have experience with good care and want to give good care, speaking out for people who are not able to fight their own fights. That's one of the reasons why I'm doing it too, because I think about the people in my mother's nursing home, which my mother's nursing home is a good nursing home. My mom's been there for 4 years. She's received good care, but I know the people that don't have family, or I know the people that their family might be more distant. They might not be geographically closer, and I worry for them. So
Yeah.
thank you so much for.
People think it's because they're on Medicaid and Medicare, but that's not true. Ervin got no better care than anybody else in that place.
And he paid a hefty price each month for his care.
Yep.
So I think that's a really brilliant point that you make, because often we say that, right? People who are on Medicaid are the poor, but it seems like the Grand is kind of an equal opportunity place where they just
There's
treat everyone
people on
equally.
Medicaid and Medicare at Kraus, and they're treated like human beings. So
yeah. All right, Cheryl, we're going to sign off now. Thank you so much for your time.
Okay. Hope it does some good.
Cheryl, it will. If anything, just getting the story out there so that people understand the challenge. I think you've done a tremendous amount of good today.
Okay.
Thank you.
I hope so. Okay. Bye.